Hello, everybody. I see that we've got participants that are pouring in, which is super exciting. We're going to give it just about a minute to get started because we've got a really packed agenda. We just want to add a couple more panelists from our audience. So we're going to go ahead and do that, but we're super grateful that you joined us today. And we're excited to talk more about this program and ways that we can partner to serve kids and families across the state. We're going to get those partners added just like I shared. Here we go. I think that should do it. Okay, let's get this PowerPoint teed up. And here we go. So good morning, everybody. My name is Gina Cabadoo, and I'm one of the program coordinators with Kids Mental Health Pierce County. And so we're super excited that you're joining us here today as we talk about the Youth Regional Behavioral Health Navigator program. We've got representatives from our partners, across all the regions that are implementing this program statewide. We've got our friends from DDA and we've got our friends from the Healthcare Authority. So we're going to kick off by saying welcome. We're excited you're here. We've got about an hour today. We're going to talk about the components of the program. We are going to incorporate answers to some of the questions that you submitted during registration. And then we're going to find ways that we can connect and partner during and after this presentation. So as we kick this off, we also really wanted to start with a land acknowledgement. So for me, I am currently located in Pierce County. So the land acknowledgement here that I wanted to read off today to make sure that I honor our words as best as I can to make sure that I'm showing respect for how we want to pay tribute and appreciation. So we as Kids Mental Health Pierce County wish to pay homage to the Indigenous people and land on which we are on today. For thousands of years, this land has been home of the Stillicum, Puyallup, Cayuse, Umatilla, and Walla Walla peoples who have remained committed to the stewardship and cherishment of this land over many centuries. We are honored and grateful to be here today on their traditional lands. The purpose of these statements is to show respect for Indigenous peoples and recognize their enduring relationships to the land. Practicing acknowledgement can also raise awareness about histories that are often suppressed or forgotten. We recognize that this land acknowledgement is one small step towards true allyship, and we commit to uplifting the voices, experience, and histories of the Indigenous people of this land and beyond. So I know that this is a statewide webinar. We've got friends joining us from all over. That is just the piece that I wanted to lead with because we are joining, at least in my case, from Pierce County. So with that, I wanted to just kind of give a little bit of a basis on how we got to this program. So Kids Mental Health Pierce County is a community coalition, and we had a program that is launched, and we've got a model that is rolling out statewide as the Youth Regional Behavioral Health Navigator program, which you're here to talk about today. So we all can just, as our headlines say here, just pick a headline, and we know that youth behavioral health is a crisis. It's very complex. This is seen across the state, across all demographics, for all populations and all communities. And we know the impacts of programs of experiences like COVID, but we also know that this happened before COVID hit us, right? So to give a little bit of a backstory, back in about 2017, we were already, for our backbone organization at Mary Bridge Children's Hospital, experiencing a 400% increase in youth being seen in the emergency department for behavioral health crises. In 2018, there was a youth that presented to the hospital with a really complex presentation. This youth spent 6 weeks in the emergency department trying to meet their behavioral health needs, and it really just highlighted a lot of system challenges. Internally, there was some staff injuries. It led to hundreds of thousands of dollars in unreimbursed costs, and it really showed that there was silos in the current systems that were working together to try and serve this youth with their behavioral health needs and their overall wellness. And so what came of that is leadership got together, and with some early funding from the Mary Bridge Foundation, there was funds to convene our first ever Children's Summit back back in 2018. And with that, we gathered a variety of different stakeholders and key partners like schools, law enforcement, behavioral health providers, and we were able to hire some consultants to help gather some data and have conversations about what does youth behavioral health look like and how is it experienced. And from that, it led to some community agreements and some brainstorming about how can we actually pull the resources that we have together and implement some actions to be able to serve youth and families better in our community. And what came of that, in part, was a coalition that we now know as Kids Mental Health Pierce County. So as that program grew, there was some action teams that were working on some community-wide initiatives. There was deep engagement from a steering committee that had some key partnerships and stakeholders to really promote some mutual benefit and buy-in to impact all of our systems and our organizations. And it was really well timed at that piece because that's when COVID did hit. And as we all know, that's when youth behavioral health also continued to exponentially get more complex and more prevalent. So we had a really great foundation of some great relationships. There was also a website, the Kids Mental Health Pierce County website, that listed a wealth of different behavioral health resources and partnerships. And through that, we were able to make sure that families, wherever they were, whatever they needed, were able to tap into the great partnerships that we had in the community, find out what resources were available. But we were also to find ways that were innovative in being able to collaborate to serve youth and their families. And we know those as multidisciplinary team meetings. So we're going to talk a little bit more about these components and how they're being rolled out across the state, the steering and the action committees, so that we can have some community-wide cooperation, collaboration, and innovation to serve youth and their families, how we can all pull together with multidisciplinary team meetings to bring community behavioral health to families with the partners that we have in our areas, and how families can tap into their local resource hub through their regional website with these teams and their amazingly talented behavioral health navigator partners to be able to serve those youth and families. So to give you an aspect, we talk about the different components of this program because there's no single system that's going to be able to serve all the needs for children and families in our communities. And it's going to be a multi-layer complex piece, and it's going to take a lot of parts to get together to be able to serve those needs. And so we really love this slide here that we were at right here, because it really shows that these are complex pieces, and we're going to have all those partners working together to really be able to support our youth and our families. So now that we've got a little bit of the orientation about how we got here, some of the program components, we really wanted to talk about how we got here to all these partners on this call today, where we have a programmatic partnership known as the Youth Regional Behavioral Health Navigator Program. And it's a partnership between the Healthcare Authority, our friends at Developmental Disabilities Administration, and Kids Mental Health Pierce County to roll these program components out statewide. So it's supposed to be 3 regions a year for the next 3 years. We're actually in year 2 already, but really what it is taking models that can be pushed across the state, but still have the flexibility to meet the different needs of the communities and the strengths that are there to support the families that are reaching out for resources for behavioral health systems. So we just wanted to highlight some of these partners that are going to be collaborated with across the state with these Youth Regional Behavioral Health Navigator teams and program components. This includes our autism and disability partners. We've got school districts, there's child welfare, there's youth services. Of course, we've got to have community behavioral health. We've got our managed care organizations, crisis, our primary care and our hospital systems, law enforcement, because no youth and family experiences behavioral health needs the same way. And no one system is going to be able to meet those for any particular family in any particular time. So all of these partners at a system level and both at those local levels with those multidisciplinary team meetings actually are all coming together to serve youth in collaboration. And I would love to turn it over to our partner, Megan, to talk about how Developmental Disabilities Administration is partnering in this program and some of the exciting things coming down the pipeline. So Megan, I turn it to you.
Thank you. Thank you so much, Gina. My name is Megan Hawkins. I am the Developmental Disabilities Administration Program Manager for the Youth Behavioral Health Navigator Program. The Developmental Disabilities Administration has several positions that are supporting this program. We have Shelley Bogart, who is our Respite and Short-Term Services Unit Manager, who is my unit manager, and we work closely together. And then in each of the 3 DDA regions, we will have regional navigators. And their role, as well as ours at headquarters, is to partner with the behavioral health administrative service organizations and the healthcare authority to support youth with developmental disabilities and their families in navigating service systems. I've included as a resource on the slide that you can access later, the DDA Eligibility and Services Guide that has a lot of great information about how the eligibility process works, what are the guidelines, and the services that are available through the Developmental Disabilities Administration. We partner with the behavioral health administrative service organizations in each region to combine the DDA services with the other services that are available in communities. Through the multidisciplinary team meetings and the relationships that we're building in each region, we are already seeing improvements in collaboration and streamlining of communication. The other role that Developmental Disabilities Administration has in this program is to identify and address barriers to accessing services. And one of the things that we already know is that providers often don't have confidence in supporting youth with intellectual and developmental disabilities. And so today I've included a couple of resources that you can share with providers and other folks in the community to help build that confidence, to be able to know that a lot of the work that you are already doing can be adapted to work with youth with intellectual and developmental disabilities. The guidebook, Meeting the Mental Health Needs of People with Intellectual Disabilities, is a really great resource that lists DSM diagnostic categories and how they might be adapted for folks with developmental disabilities. The Mental Health and Developmental Disabilities National Training Center resources are virtual trainings that are self-paced and cover a wide range of topics that can be helpful, again, in increasing provider confidence and a sense of capacity for supporting our youth. That is everything I have around the work we're doing with developmental disabilities. We are really excited to bring our regional navigators online in the next year or so as we develop those positions. And we're looking forward to continued collaboration.
Wonderful. Thank you so much, Megan. And I wanted to turn it over to Edward and or Jennifer, our friends at the Healthcare Authority.
Hi, my name's Jen Chancellor. I am a contract manager for the Healthcare Authority, and I work with the Behavioral Health Administrative Service organizations. And I wanted to talk about the rollout of the program. I'm not sure if we need to bump to the next slide, Gina.
There we go. Thanks, Jennifer.
Yeah, no problem. So in 2021, our legislative session, the lawmakers funded the existing Kids Mental Health Pierce County program and also funded them to provide technical assistance for the rollout of the Youth Behavioral Health Navigator program across our state, funding 3 regions per year to achieve statewide coverage by the end of state fiscal year 2025. The behavioral health administrative service organizations were identified as the administrative bodies who were going to be rolling out the implementation of this program. And they were also offered the opportunity to self-select implementation order, meaning they were able to select which year they wanted to stand up their navigator teams. As you can see here in our first year, which started in July of 2022, Pierce continued their existing team and they provided technical assistance and support to the Salish, Greater Columbia, and Southwest regions as they stood up their teams. This year, beginning July 1st, 2023, our North Central, Spokane, and Great Rivers regions are stepping up and starting the rollout of their navigation teams. I did want to make mention of the American Rescue Plan Act funding. I hope I got that right. We call it ARPA funding, and talk a little bit about ARPA funding and how it is complementing this initiative. So during COVID and before our ledge had funded implementation of this work, the Healthcare Authority wrote into the ARPA plan and sought approval to stand up a version of this program in Washington State. And that was approved, and this funding became available to us this spring, and it's going to be available to us through September of 2025. So our Thurston Mason region has stepped up and agreed to start their implementation a year early with this ARPA funding, and then they will switch over to the state funding when that becomes available to them. Additional ARPA funding has gone to our year one regions as they have explored and piloted multi-county implementation. We do anticipate that there will be differing staffing needs and costs for our multi-county regions, and we really look forward to learning from these year one regions as they explore their implementation, and they will help inform our anticipated decision package to have statewide coverage and support a step beyond the regional coverage that is currently funded. The ARPA funding has also been used to support web design and startup for our incoming regions. And it's also supporting the amazing work done by Gina and Ashley and her team to provide technical assistance as they meet with the multiple regions and also with all the regions during learning collaboratives, as it's important that we learn from the work that one another is doing. So during year 3 of our rollout, we anticipate King County and North Sound to join in on the implementation. And we are happy to announce that conversations are already underway with King County at this time. I was also asked to say a quick note about how this program is going to integrate with the work from last year's legislative session, Second Substitute House Bill 1580 on children in crisis. So we are actively working with the governor's office and our sister organizations as the governor's office stands up requirements of Bill 1580. We also look forward to partnering with the regions as they stand up their kids' mental health Washington teams, and also other initiatives like a partnership that's led by DCYF on youth and young adult housing response teams. But how it exactly all folds together, I mean, there's so many initiatives currently right now that are being stood up across our great state. Things like the Children's Mobile Crisis Response Teams, our Educational Service District Navigators, the SUD Blake Bill work that can serve youth. And as we all move forward, we think that we are all going to learn together as we move through the next couple years with all of this exciting work that's happening. And that's all I have right now, Gina. I did want to mention that I am, standing in for the amazing Diana Cockrell and Edward Michael, and I think that they'll be able to join the webinar later in the hour to answer additional questions that people might have about this.
Awesome. Thank you, Jennifer. And I think you touched on some really great pieces about like how we're all going to learn from each other. So this is going to be a tiered rollout. We're in year 2, just like you said. So we've got a good chunk of the state covered. And what's been so powerful to learn from these different behavioral health navigator teams, because there's teams of 3 in each of these 10 regions across the state, is there's a lot of differences in how families are being served. So what's it look like when you've got a multi-county area compared to just like what we had when we launched this in Pierce, when you've got huge areas like our friends in Greater Columbia that have 9, or what's it look like to serve a rural community versus an urban community for those regions that actually have both demographics? What's it look like to have cultural differences and how services are provided? What does trauma informed mean for the populations being served? So these are all things that we're all learning from each other through a monthly learning collaborative that all of the regions, Healthcare Authority, and our friends at Developmental Disabilities Administration participate in. What does that look like from a systems perspective, a community perspective, and a family perspective? So we're really excited to have these new regions coming online. We're also really excited, Jennifer, to your point about the fact that we're collecting some shared metrics. So all of these regions on a monthly basis are reporting on those multidisciplinary team meetings. So when they're bringing community providers and experts from their local communities with families and or youth that are experiencing behavioral health navigation needs, whether that could be medication management, behavioral health strategies, maybe it's just coordination of the different services and programs to make sure that we're being efficient, that we're not duplicating, that we're really doing this in collaboration and partnership. And then there's also a quarterly narrative that we're reporting on of telling not only the numbers of a story of what's it like to serve families and communities, but also what are some of those intricacies about what does it actually take to serve youth and families, and then collectively what can we do to advocate together to make some system and policy level changes. So I know we got lots of great questions from the registrants. We wanted to infuse some of that into this, and one of the ones that we got so much is like, how is this program engaging in cross-system work, and how can you all partner? Those are super great questions. And so some of the things that we can absolutely work together on is please do participate and refer to multidisciplinary team region meetings in your region. That's definitely a resource that's available to your organization, to your family, to your friends, what have you. Get involved, join the steering and the action committees that each of these regions have so that you can engage in some cross-system partnerships. That's a huge piece. And then you all have a ton of data and expertise on what it looks like to serve the youth and the family in your communities. And we would love to tap into those aspects. Another thing that we heard a lot of that we wanted to address is how is this program accessible and engaging parents and youth directly. So when we're talking about those multidisciplinary team meetings, when we bring the community together to do some care coordination and to come together to serve youth and families in collaboration, those are centered around the times of the youth and the family to make sure that they are engaged. They are telling their story. They're talking about how they want services and in what capacity. So that's a really big piece. I know that in Pierce, I can speak to the fact that we've had parent partners and we've had youth and we've had parents actually speak at a lot of our summits, or they're part of our steering committees. So we want to make sure that those voices are involved. I know regions are also collecting surveys from their multidisciplinary team meetings so that we can hear about what it is as an experience for families to access behavioral health navigation. We're also really big on making sure that we're out in the community. So I know there's tons of tabling that happens. There's a lot of school kickoffs that are happening right now. So we want to make sure that we're actively engaging with the families so that we're implementing their voice in the launch and the growth of this program, but also that we're available to do that behavioral health support wherever families are, whatever that looks like for them. So what I would love to do is actually turn it over to our regions. So we are currently in 8 of those regions, as Jennifer has turned over. So what I would love to do is I would love to turn it over to Vanessa, who is actually one of our program coordinators with me in Kids Mental Health, Pierce County. Vanessa, if you just want to talk about geographically what areas we cover, your name, and then where we're at in this implementation stage of the Youth Regional Behavioral Health Navigator program.
Yes. Hello. Hi, everyone. My name is Vanessa Adams, and I'm the program coordinator of Kids Mental Health, Pierce County. So our region is Pierce County. We are one of the regions that has one county, a very diverse county with lots of different needs throughout. So we are in the stage of growing and expanding the implementation of our program. Have had the honor of participating in learning collaboratives and learned from the newer regions a lot of different things that we are now growing and providing to our website, to our steering team, to our implementation teams, and just continuing to grow and support parents and families and young folks in Pierce County.
Awesome. Thank you, Vanessa. And then I see next on my screen is Meredith. Meredith, take it away.
Hello, good morning, everyone. My name is Meredith Pyhowski, and I am the care coordinator for our Youth Access and Resource Team, known affectionately here at GCBH as YRB. And we actually started the program in July of 2022. We were provided some funding to get things started in our region. And so it was great internally to get the support of GCBH ASO as well as Kids Mental Health Pierce County to get started actually 6 months before we did our first launch in Benton and Franklin County. And when we did that, we developed our steering committee. We were meeting twice a month with our steering committee here in Benton and Franklin counties and developing our program. And so we have been live in Benton and Franklin County since January of 2023. We'll be launching Asotin, Garfield, Whitman, Walla Walla, and Columbia counties in January of 2024. And we're really looking forward to expanding to those areas. And then we plan on launching in Yakima and Kittitas counties beginning in January of 2025 and sooner if we're able to do that. So we're just really excited to be launching in this area. We've had a lot of great meetings and great success with our partners in Benton and Franklin counties, and we're really looking forward to developing more partnerships and collaborating with all 9 of our wonderful counties that we have in the Greater Columbia region.
Awesome. Thank you, Meredith. Excited to have you. Next, I would love to turn it over to our friend Jolene in the Salish community. Jolene, can you hear us okay?
I can. Can you hear me?
We sure can. Thanks for being here.
Sorry, traveling. So just been chatting from the car. My name is Jolene Cron. I'm the Deputy Administrator and Clinical Director with the Salish BHASO. We serve Kitsap, Jefferson, and Clallam County. So the upper left, far west of Washington. We have some kind of suburban and quite a bit of rural area that we cover. We started our development of our rollout in fall of 22 with our full rollout happening August 1st for all referrals of this year. We do have most of our infrastructure in place. We have recently had a vacancy in our team, so we are hiring a supervisor for that team. We do have our coordinators strongly in place. And we are continuing to work on strengthening those relationships and garnering the additional folks that we haven't yet got at our tables. Our website is up and running and we are refining as we go, and that is where we're at.
Thank you so much, Jolene. And I love the piece about refining as we go. One of the pieces that we hear a lot of from families is that they don't need another door to an empty room. So each of these regions with their regional resource hubs works to actively keep these websites up to date with the spectrum of behavioral health resources in their community so that it is current and that we're getting the most readily available information out to the community. So I would love to turn it over to our third and final last region that was the first wave of the rollout, who also kind of straddles this next wave. So Brooke, I turn it over to you.
Hi, thanks everyone. Glad to be here. I'm Brooke Vale. I am the program manager for the Southwest region. And we cover Clark, Skamania, and Klickitat counties. And we are a pretty broad region in the sense that we have very urban areas of Clark County, Vancouver, and then also very rural areas in all 3 counties. And so we got started in the fall of 2022, and we started taking referrals in March of this year. So we're fully up and running with referrals and have been really thrilled with being able to directly support youth and families over the last 6 months in the Southwest region. Our website is up and running. We are working on just adding more to that website. We want it to be a really functional resource for families, for schools, anyone who is coming in contact with youth and families. We're excited that families have been able to find the Navigator team through our website. So we've gotten quite a few referrals directly from families. And we are looking forward the next 6 months to be working with our community partners, particularly schools. And we just hired a Navigator in Goldendale, Washington, which is the very rural part of Klickitat County. And so that has been an exciting addition to our team. Casey Bellamy, she's amazing. And we are really looking forward to serving our most rural youth and families in a very direct way.
Awesome. Thank you, Brooke. And so that kind of launches us nicely into our friends that just launched as of July of this year. So I'm actually going to turn it over to our friend Gary in the Thurston Mason region. Gary.
Well, good morning. I'm Gary Enns from the Thurston Mason BHASO. I'm our quality manager and children's care manager. And as Jen mentioned earlier, we were invited to join this party a year early, which we're very excited about, but we are very early in the implementation planning phase. Our first step is to hire a Youth Navigator program coordinator. And once that person's hired, then we'll start convening our community steering team, some sort of action implementation team, jump into the gaps analysis process, map existing resources, really be thinking about, where some of those existing resources are going to intersect with these new opportunities, and be very planful about that. And then we'll really be working closely with our, that community team, which is going to be our, is our system of care folks to build the model. And we'll be looking at what additional Youth Navigator positions we need to fill, what our multidisciplinary team process will look like, what our website or websites will look like, and then finally, really start thinking about the navigation piece and what these navigators can do, what those services and supports will look like. So very excited, but early in the process. So stay tuned. We'll tell you more at our next webinar. And I'll drop my contact info in the chat. Thank you.
Thank you, Gary, very much. And I would say, Stephanie, I'm going to turn it over to you in Spokane, but Stephanie, it looks like you did something different with your hair and you're on here twice. So I don't know if I should turn it over to Stephanie and or Josh.
Yes, hi, I'm Stephanie. I'm the program manager for the Spokane County Regional Behavioral Health Youth Navigator program. And similar to the Southwest region, we have a pretty diverse population of urban and rural settings with the 6 different counties. And we're in the very early stages, as well as Gary had mentioned. We're currently in the development phase. So we're working on hiring staff, creating partnerships, learning from other Youth Navigator programs, and then just kind of introducing the community to our program, what that means, getting feedback about how we can best benefit different programs and resources in our community. And we're thrilled to be working with the other regions, learning from them as they develop their own programs and refine them. It's really been helpful to observe the different types of meetings they've had to see how we can kind of piggyback off of those ideas. And I think one of our goals is to just have our website live by January 2024, maybe not exactly taking referrals, but just getting it live so that the community and members and families can understand more about our program.
Wonderful. Thank you so much. And I think we covered all of our teams. So as you can see, we've got a lot of energetic teams members that are here to be contacts, whether it's a first phase regional rollout where they are about a year under their belt, they're getting their program up and running and they're working closely with their community, whether it's the regions that have just launched and they're trying to navigate, how do we make sure that we build upon the great things that are already happening in our community and find the best way to serve families and youth in their community. And then of course, we've got our friends in the North Sound and King County regions that are going to be launching next July. Into Jennifer's aspect, are already in talks about what that's going to look like. So we're super grateful to have such a great team that's going to be doing some really amazing work and is already doing some amazing work in the areas they serve. What we would love to do is turn it over to a little bit of a Q&A. We got some questions from
Nina, can I interrupt you just for a second?
Oh, Carrie, I see your hand there. I'm sorry, Carrie. Go ahead.
Good morning. My name is Carrie Googe, and I'm with Great Rivers BHASO. We are part of the second year rollout. We're really in line with Thurston Mason, actually. I would say, I've just listened to Gary. That's the same for us, but to be a little bit more informative. Yeah, we are soon hiring. I will be overseeing this program, so that's why I'm here. Really excited to post a position to get things going. Infancy stage is really what it is, but we're trying to grow. We want this baby to grow, so that we really are investing a lot of time right now in learning from other regions that already have a pretty nice handle on this program and are doing amazing work. It's very impressive. We are taking advantage of learning as much as possible from Pierce County. We're very appreciative of the amount of information and opportunity to figure out how to do this well. I know that what we're doing in Great Rivers, and by the way, I apologize for not being more specific with our region. The Great Rivers region is a 5-county region. We cover Lewis, Grace Harbor, Pacific, Wahkiakum, and Cowlitz counties. So, we do have I-5 running up through part of it, but we also have a lot of rural and frontier areas as well. So there are a lot of questions in regards to how this is going to look. And I think that's part of the phase that we're in. Once we get somebody hired and we can really start doing those needs assessment, getting the information out to the community, trying to get feedback from our community to find out how is this going to look? How can we make it our own? And so that's pretty much where we're at and what I'd like to report on for today. And I promise the next time we'll have more to share. So thank you.
Awesome. Thank you, Carrie, and thank you, Megan. So now I would love to turn it over to a panel discussion with all of our partners that are part of this webinar today. We got some questions from those that registered for this webinar, so thank you so much. We wanted to cover just a couple, and then I do see some coming up in the chat. We will answer them as we have time. Otherwise, we'll make notes to follow up with you directly. So in addition to sharing out how you can connect with these teams through our website, which we're going to have a QR code on the next slide that you can scan, I'm also going to be dropping the regional websites, the Kids Mental Health Washington website in the chat so that you can tap right into whatever county or region you're trying to connect to. We're also going to work on putting the contact information for each of the regions in the chat as well, so that you can follow up directly on those aspects, especially for our friends that are still launching their resource website just because they launched in July of this year. So the first question, and I'll turn it over to this team for, is what has the community response been as you've rolled out the Regional Behavioral Health Navigator program in your region? And we'll just make it an open discussion forum, so pop on in whenever.
So this is Brooke Bayon. I'm with the Southwest region, and coming into this a year ago, it was we were not sure how the community was going to respond to another Navigator type of service. So I wrote down a quote because I think quotes go a long ways, and that's kind of been the driving force of our team. We have a team member that is all about quotes, and so we've been gathering some information from our community partners as we go, and we have been sending surveys out. So this was from a school principal that filled out our survey. And she said, "You and your program have been a game changer for us. And my heart is so happy that we are finally able to find supports we have so desperately needed." And it wasn't that we created anything new that wasn't already there, but we had spent some extra time in particular with this school, and we're continuing to partner with them in this upcoming school year to make sure that they are feeling like they have the resources and support that they need to support the youth that they serve in their school.
Awesome. Thank you, Brooke. And we do love quotes, so that's a very powerful one, and thanks for sharing that with everybody. Maybe like one or two more responses from our other regional partners.
This is Meredith, and I'm with the Greater Columbia region. And our initial launch in Benton and Franklin counties, we had a really great response. We had a lot of community partners that were really excited to join our steering committee, excited to hear about the the program and what it can do for the community and how it can provide additional support for both the agencies and the families in our community. So we've had a really good response. You know, when you get a group of people together that really care about youth and families in their community, which is what we have done, it's just really powerful, and it's just been a really great experience for us to collaborate with agencies, collaborate with organizations, and really see how much hope and just really energy that there is in working with the youth and families in our community. And it's been a really great opportunity to see, and really cool to see a lot of relationships that are being built within our these two county regions, and we're really excited to bring that to the rest of our Greater Columbia region as well.
Awesome. Thank you, Meredith. And then maybe one more, even like from, I don't know if Megan at DTA or maybe Jennifer at HCA, you have anything that you want to share?
This is Jolene from Salish. I just wanted to jump in. I think we had really positive response with the relationships in our community. I think the one question that has come up and that we've been working through in our steering committee is how not to duplicate the coordination of services with other programs and with the providers who are providing the direct service. So that's been a big part of the focus in conversation as to how we, as a non-service program, provide support to those service providers and the connection for those youth and families.
Absolutely. And it's that intentionality about how do we best partner with the resources that we have and the partners that are doing really great work. So thank you very much. I didn't know if Megan or maybe Jennifer, you had anything else you wanted to share before we went to the next piece?
Yeah, I can just share that we are seeing impacts both for the youth that we serve and in the systems, that the way that the program is structured is supporting that cross-system collaboration to be more efficient and more effective. And so we're seeing those results with youth who are receiving services and getting their needs met, as well as impacting the system to be able to address those needs at a lower level of intervention.
Thank you. Okay, well then I'll turn it to the next question that we got, which was, how will this benefit small rural providers? I know a lot of our regions have some big geographic areas that are rural, and then we've got some areas that are still very small, but still very rural. So what are your thoughts on how this benefits the small rural providers?
I can go again.
Oh, go ahead.
Go ahead, Jolene.
I was just going to say, you know, as we're continuing to develop, I think our rural providers often have much smaller teams. And so the ability to have additional resources brought in have been part of what they are excited about. And also seeing what can be expanded or what's being done in other areas that we can bring to them in those more rural areas that haven't existed already.
Yeah, and I was going to add, in Southwest, we've been really intentional in talking with our rural communities as we were building our support system and how our services were going to look. So in Klickitat County, we really heard loud and clear, and as well in Clark County, the more urban area, that our community needed someone who was going to directly interact with youth and families. And so our navigators do a lot of direct work with families leading up to multidisciplinary team meetings, trying to figure out, okay, what do you want to get from this team? What do you need help with? So we're using their voice to drive how we support them, and each individual interaction with our rural community is developed around how they want our service to work. So we intentionally hired someone who lived in that Klickitat region, because that's really what they felt like they needed in that community, was someone who could be the voice for youth and families there, and have that direct presence in schools and in the community.
I wanted to add to what Brooke was saying. For those who know me, know that I am from a rural community. And so I often advocate for high quality healthcare in rural areas. I think one of the amazing things about having a regional model is a regional model can be more responsive to the needs of their rural partners and what rural communities are needing to make programs like this successful. So I just applaud what Brooke had said when they indicated that they hired somebody from a rural area to help service that rural area, because how you provide care and the connections to community and the relationships in community that you create and establish in rural areas may look different than in urban areas. And so I feel like this program having a regional model is something that can be very responsive to the differing needs that we have across our state.
Awesome. Thank you so much. I think another question that came from the audience that we can speak to is, based on your experience, are you able to identify service gaps, and what are you doing to meet those in partner?
And Gina, I did see Carrie Googe had her hand up. I didn't know if you were able to see that.
There we go, Carrie.
Sorry. So again, our region hasn't rolled this out yet, but what I envision, to answer the question that we were just talking about, oftentimes a lot of our rural providers or smaller counties feel forgotten. And a lot of the burden is on them to do things to wrap around families, and they don't always have the resources or capacity. And so it just makes a lot of sense to me that the benefit here we're really trying to get community investment with other systems to come together, really wrap around these families and invest in their wellness and recovery and help them. And so it just makes a lot of sense to me that that would be something that the rural providers could really benefit from and maybe buy in to this program. So we'll see. Wish us luck. Thank you.
Thank you.
This is Vanessa from the Pierce region, and I would love to just kind of both of those questions, the new one Gina asked around bridging the gaps in the last one. And I think one way of addressing and acknowledging that is inviting folks in from those communities to the initial action teams, to the implementation teams, to the tables, having representation from young folks from different school districts, parents, doing focus groups, asking the questions to the community and bringing those community members in to know what the gaps are, to hear, what are you missing? What do you need? We can point all day to the things we think folks need, but I know what the folks need that are closest to me in my area of the community, significantly different than folks outside of my direct. That little slide that showed community, and as it built up, like I know closest to my close home community, and as I get further away, I need to bring folks in. I need to be intentional. We as a coalition are very intentional around bringing people in from different communities and asking them. We have folks on our steering committee that are parent supports. We have folks that come provide feedback to us that are young people from different school districts. So I really think that a way that we are working to bridge gaps is to hear from the people that are experiencing those gaps.
Powerful. Thank you. So if anybody wants to add on to the piece that Vanessa beautifully segued onto, which was the question about the gaps in your community, like how are you able to identify service gaps? I open the space to do so.
I think we identify service gaps by just being a part of, this is Meredith from Greater Columbia again, from just being a part of the discussions, from getting the referrals, seeing what the families and the schools and the people in the emergency rooms, whoever is referring the youth to us, and hearing from the youth. The youth are also welcome at MDT meetings, if they feel comfortable and if that's something they want to do. And we want to hear from them what services they need and what will help them be successful in the future. And so I think it's just inviting everyone to the table. I think being out in some of these smaller counties that maybe don't have as many resources, I think can really just us being there and hearing what the gaps are, talking to folks that live there, participating in community events. I think that's how we're going to hear what those communities really need. And then we can work on how to strategize to come up with creative solutions to those gaps and barriers.
Awesome. Thank you. Then I will turn it over to one more question, keeping an eye on time and see if we have space to keep answering the Q&As that are coming in. So for our partners that are on the call today, could you please explain how this is different from or will work in conjunction with the existing community resource teams, programs such as CLIP or FISPERT? Thinking maybe Vanessa or Meredith, given some of the multiple hats that you guys wear, maybe you could speak to those experiences you've had.
I can go. Hi, this is Meredith again from Greater Columbia. So the work is slightly different, but it all kind of has the same goal, right? And that's to help youth and families in our community survive and thrive and be successful. And so there are differences in what our Youth Access and Resource Program does compared to CLIP. You know, CLIP is a residential treatment facility, a residential facility where youth go for long-term treatment. Our program is different in that we are trying to find ways to make and keep the youth successful in their community in which they live. So it is different in that regard. But it can all be kind of interlinked. There definitely could be a youth that has an MDT meeting, tries a lot of resources, does a lot of what we suggest. They're still not doing well. And so that youth may then be referred to CLIP and go through the CLIP committee process and go to CLIP. So it's, you know, we don't want to have as many silos and not connecting youth and families what they need. If a kiddo goes to an MDT meeting and it's determined that, hey, you know what, I think the group is kind of thinking maybe CLIP would be a good option for you because of these different reasons, then we would either refer to the appropriate person or talk with them about what CLIP entails and how to make that happen for that family. So that's part of what our program can do, is kind of bridge the gap between all of these different programs and have the knowledge and the information and the connections to get the family to where they need to be.
Yeah, to add to that a little bit, I feel very similar to how Meredith was describing, and I've also seen it work vice versa, the opposite way. So a young person went through CLIP committee, was not referred to CLIP. And at that time, the family was not in a space or place looking to connect in a similar way to the same community partners or that MDT had to offer. And after they were not referred to CLIP, they were very engaging with the MDT process and felt very supported with getting additional resources after not being referred to CLIP. I've also done MDTs for kids coming out of CLIP to help the transition back to the community, as well as with the wait list, oftentimes fluctuating, but sometimes it's several months, sometimes doing an MDT in the interim before after they're approved for CLIP, but in the interim while they're continuing to need a high level of support. I've facilitated MDTs for those youth to help do some care coordination and keep folks on the same page to support that family and that young person in the interim before they do have access to a CLIP bed. So as Meredith was saying, I think being a connector between some of these I also am a member of the FISPR. I also sit on the CLIP committee, and I try to support interconnectedly with all of these spaces. And that has been really effective for knowing more ways to support kids and families. And I think the wider we can cast that net, the better and safer our young people are.
Absolutely. Okay. Well, I'm keeping an eye on time and chat. I know that hour goes by so fast, so I'm dropping a couple more answers to Q&As that we've received, and I know that there's going to be more, so we've got some notes down to follow up with the people that we haven't been able to address in the chat. Another thing that I wanted to call some attention to is we've got a question about who this program serves in Washington State. So the focus is on school-aged youth, regardless of insurance type. That's something that's been really exciting also across the regions. And if you've got questions about how to get access to behavioral health resources in your community, if you're really excited to partner and you want to get involved with those multidisciplinary team meetings or MDTs as we talk about, or if you want to get engaged at a steering committee level or an action team level, I did drop the chat for each of the partners that were on this call today in the chat, so that you can access those directly. We've also got in the chat our statewide website, where you can get a hold of all the different regional websites and also get in contact with each of these partners and figure out what's going on in your community. And what I would love to do is also find one more way that you can get connected with our team, with our very last slide that is right here, where you can get connected with our different partners. So if you scan this QR code, or again, this is going to come out with PowerPoint slides, or you can access the information in the chat. We've got our friends at the Healthcare Authority. We've got us at the Kids Mental Health Pierce County team that are providing technical assistance and support with all of the regions. And then we've got our friend Megan that's on with Developmental Disabilities Administration. So you've really got all the systems and partners that are working on this to collaborate across the state. So I wanted to say thank you so much to our panelists for the work that you're doing, for the rollout of this model and its components across the state, and for you all for tuning in and for caring about kids and families and showing up every single day in the way that you do. So with that, I'm seeing some hearts that are coming in. I'm going to type out one last answer here. And thank you guys so much for tuning in. It's going to be recorded. It's going to be posted on our website. And please take care and have a great day. Thank you so much, everybody.